Switching gears a little bit, the letter from Representative Clyburn saying that you're ignoring recommendations on how to stop the spread here in Oklahoma, calling our situation dire. What is your response in none of those recommendations happening here in our state?
Well, I'm on calls every single week with the president, the vice president, 49 other governors, and we look at all the recommendations and we make decisions based on the facts here in Oklahoma. And that's when we rolled out our color-coded system to give counties some level of assurance where they're yellow, orange, or green. So we are taking recommendations very seriously. We're looking at the data, and we're making the best decisions based on the facts here in the state of Oklahoma. But there's not a...
That Oklahoma is in the red zone, but yet we don't have any red on that color-coded map. So are you saying that they are wrong?
Well, I'm saying that we look at those recommendations. We're on the calls with those guys every single week. That is what you're talking about. It's I think it's a subcommittee inside Congress that really is just trying to make a political statement either against the president or our state. I don't know exactly where it's coming from, but we've seen it. We're looking at it. We're going to reply, and we've been very transparent with our data. I'm so proud of Oklahomans. I believe we've done it the right way. From the very beginning, I issued 30 different executive orders. Right now, we have 647 people in the hospital, and we've built hospital capacity way above that. We currently are on this plateau. We're having between 700 to 1,100 cases per day. We've been on that range for the last 3 weeks. And again, I just keep reminding Oklahomans, we're fully reopened since for the last 2 months, and 98 days we started our reopening. And we've been on this plateau now for the last 3 weeks of number of cases. And we may be dealing with this and these numbers for the next year, 2 years until there is a vaccine. And I think Oklahomans are doing it the right way.
Governor Stitt, do you have a backup plan should you see infection rates spike in public schools or private schools? I mean, at what point do you decide perhaps in person is not the best option?
Well, we obviously, with our health department, we look at data every single day, and it's more about hospital capacity than anything. So some states are doing it differently, and that's the great thing about our country is you have some opportunities to look and judge and see how other states are doing it. There's states that are still completely shut down. They still have cases in their state. They still have way more deaths. Michigan, for example, is pretty much shut down. I think they have had 8,000 deaths. Oklahoma has a little over 500 right now. So we're watching the hospital capacity very closely. And if we see in a 14-day period, we would have to have about 2,500 cases per day for a 14-day sustained period before we would start going up to around 1,200 people in the hospital. So we would have some runway to start making adjustments back. Some of the recommendations that other states are doing would be bars closing down, would be reducing capacity in restaurants, in-person dining. So those are always triggers that we can pull. But again, we flattened the curve back in March and April, and if you remember, the epidemiologists were predicting 5,000 people in the hospital as early as April. It didn't happen. And so we flattened the curve, we started reopening, and we have not seen the spikes. And so we're in this period now that we're watching very, very closely. But I feel like we're on a plateau, and obviously we can make different decisions as if we see any kind of spike in our numbers.